Martin Greenhow, you're the managing director of Mojo Bars, and one of your bars is in Harrogate. Um, One of the things that's been talked about is the possibility of having vaccine passports to allow admission into pubs. Um, what's your understanding then of where that is in terms of a decision?
Uh, as things stand at the moment, what I think we're seeing the government do is floating policy to see whether the public and the industry will tolerate it. Basically, my personal view is I think it's immoral and I think it's impractical. I don't want anybody other than a medical professional asking me for my personal medical documentation. I find that abhorrent. I also worry that it's the thin end of the wedge. And quite frankly, you know, I'm not giving a doorman or a bartender or anything my personal details. You know, that's before we look at the practicalities of it, which are quite simple. You know, both you, Tim, and I have, I'm guessing, been offered or had. I've certainly had my first dose of the vaccine. Fine. To be honest, I've had COVID. I'm not sure that it was a worthwhile exercise. I think it probably could have gone to somebody else more deserving, but there it is. But I'm in my 50s. If I'm 25, which is our target audience and the vast majority of the target audience of hospitality, not to mention our staff are all around that age group, they're a long way off being able to even have access to them. So I won't be able to staff our business because they won't be allowed in because they can't certify that they've been vaccinated, which is probably helpful because there won't be any customers because they won't have been vaccinated either. So it's up there with the Scotch egg gate. It's up there with the idiotic suggestion that you open hospitality without alcohol. I think, yeah, we're running things up the flagpole to see how they fly.
But how would it actually work in reality? There's obviously when you have your vaccine, you get your little blue card with 2 days.
I,
So if you've had both doses, is that what you'd actually show then to somebody on the door of a pub? Is that your understanding?
well, the first thing is I didn't get one of those. I got a scratty piece of paper with instructions on, no name, no references. So, you know, straight away we've not got coherence of delivery of documentation. My understanding of what's being mooted at the moment is that perhaps the NHS COVID app will be repurposed to show that. Now, I suppose that's totally viable. However, I'm sure it would take the next 18, 19, 20-year-old 15 minutes to mock something up like that they'd be able to show us on a smartphone anyway. So the opportunity for, a fraudulent application of compliance is rife. Certainly those little blue cards you speak of wouldn't be the most challenging thing to replicate. So again, it seems an exercise in futility, pretty much like it would appear track and trace was on the whole.
And talking about track and trace, was it November time you were open? And that's when track and trace was being used. And I spoke to a number of people working in the sort of pub and bar trade, and I think I only spoke to one that said that they actually had one identified outbreak, and they did their own kind of track and tracing of finding the people that were on the tables near to them. But there was absolutely no spread, and it was isolated with that one individual.
Yeah.
Have you any experience of using it in your venues?
We did have it, but we were never contacted by Public Health England or anybody else. So in our 5 sites across the country, where we were probably seeing, we were seeing thousands of people a week. No incidences whatsoever. So I couldn't say. I mean, I don't think everybody complied to the letter of the law with it, though. But again, we're not policemen. What are we supposed to do? You ask people, you show people, you take them to it. Request they've done it, they say I've done it. There's not a great deal we can do from there.
So looking forward to kind of the current known situation, you're fairly soon going to be allowed to open your outdoor areas.
Yeah.
Is that what you're planning on doing then? Is it
Yeah.
a small area in Harrogate and then your other sites?
Yeah, shameless plug coming up. We have a delightful roof terrace in Harrogate, which I hope people will enjoy. We're also looking at the possibility of securing a cafe license for the front of the building, which we're just working on with the council. And then two of our other sites in Leeds, Merrion Street is going to be, I think that's probably going to be very popular in Leeds because we've managed to secure agreement from the council and all the other operators in the street, so that we're actually going to have a marquee roof on there. So at least, as I keep saying to people, we're opening outside, but this is the north of England. It's not the Caribbean. The chances of rain are fairly high. And then in our Liverpool site, yes, we've got some outside area behind there. The other two sites in Manchester and Nottingham, though, which are our two best performers, normally will stay dormant until till May.
And is that working to? It's sort of sometimes difficult to keep track unless you're in the trade. Is that working to table? Is it table service?
Yeah.
And is it 1.5 or 2 metre distance in you now?
So we're 1 metre plus, but of course you're gaining part of that plus by the fact that you're outside and in the fresh air. But yeah, we will be maintaining that distancing. It's ordering from the table. We will deliver food and drinks to the tables. We have an interface that's NFC or QR code tap, opens up a browser on your phone and you order and pay through your phone, which, to be honest, worked really well before we were closed down last time, so we were delighted with that. People seem to quite like it. I think people used it as a bit of a voyage of discovery, so there was lots of new products, people trying different cocktails and things, which was quite pleasant to see, to be honest.
Martin, thank you very much.
You're welcome, Tim.